Hey gang, this is Dr. Hugh coming at you again, and I have another case today, a case that of chronic problems. I'm going to walk you through the steps I took him through to see if you can actually relate to this. Now, if you're out there and you're suffering and you're watching this video, you're probably suffering, okay? I'm going to assume that you're not just killing time wanting to hear me speak. So if you're here, you're watching this, I hope you can relate to this, and really where my skill set comes in helping you is act as a guide, right? I'm just a guide. I've helped thousands of people recover. So as we go through this case, you'll actually understand like what's involved with actually recovering someone and getting you better, whether it's you've been damaged by antibiotics, you have fibromyalgia, you have brain fog, brain fatigue, tendon problems, IBS, irritable bowel, whatever it is, you got to do the proper workup, and then you can see what a proper workup actually looks like. And if you haven't had this workup, then there's good news. There's good news that you can possibly get well with a workup that's like this. So let's dive into this. Okay, so this is his initial paperwork. He has damage by antibiotics. He has vision loss, pain, and pain and inflammation all over his body, and then food sensitivity. So one of the things that we did is when people come to me is I do an organic acid test, I do a mold test, and then I do very extensive blood work. Now, in this demonstration, I'm only going to show you the organic acid test, and then I'm going to show you his blood work, and it's just going to be very, just little pieces of the most important things that I found and how it relates to him getting better. So right here, this is the organic acid test. Markers 1 through 9 have to do with yeast and fungus. And guess what? Mold is actually a fungus, so it falls in this section here. So when we look at the yeast and fungus markers, there's 9 markers here, and you can see this H here. So let me just get oriented you to this lab. So this would be like normal, right? And this would be a normal finding right in here. And then you can see right here is this falls outside of this normal range right in here. So out of the 9 markers, he has 1, 2, 3, 4, 5 markers in the fungus and mold sections that are abnormal. So out of 9, he has 5 that are definitely abnormal. So what's this telling you? This is telling you that his gut is full of mold and yeast and overgrowth. So let's just look at this. So you see this right here, number 5. So this is aspergillus. This is a mold marker. So he definitely has mold in his gut. Arabinose. This is Candida. So Candida is a yeast. So he has high levels of Candida. He pinned the needle right in here. And then down here, number 9 is tricarboxylic acid, is fusarium mold. So this is mold here. This is mold here. And this is yeast, but this is specifically Candida. So what are we saying right now? What are we saying about his gut? It's a disaster, and he's loaded with a bunch of mold. Okay. Now then, this is on the second page here. Then we actually checked oxalates. So I have some videos on oxalates. So what are oxalates? Oxalates are small little crystals that can form in your muscles, in your brain, in your kidneys. You've heard anyone that has kidney stones, they're usually calcium oxalates. But these small crystals can form all over in your entire body. Now, if you have chronic conditions, in my experience, people have high oxalates. And these little oxalates can be, let's say that it's in your muscle tissue, and every time you move your arm, your pain is painful because the oxalates are very small. If you go on Google and search oxalates, they almost look like small little shards of glass. They're very, very sharp. And when they get in your body, they can cause lots and lots of damage in your muscles and in your nervous system. So he has high oxalates. Then we also checked the neurotransmitters here. Now you can see here, this is dopamine, and then down here we have norepinephrine and epinephrine. So number 33 and number 4 on here have to do with the hormones that kind of like what I would say rev you up. So dopamine, right? Dopamine gets you going and gets you moving, and that puts you in a sympathetic storm or more of a fight and flight storm. So if I just see a tiger, I'm going to want to run. Right? This is what dopamine does, and this is also what norepinephrine and epinephrine does, is they're excitatory hormones. So what do? They pull blood away from your gut and stick it into your arms and into your muscles. So some people that have this this presentation, they're not getting enough blood down into their gut. So they have constipation, they have diarrhea, they have Crohn's disease, they have bloating, they have gas because not enough blood is getting down there because they're in this sympathetic state here. So you can see how dopamine is elevated and the norepinephrine and epinephrine it still falls within normal range, but it's on the high range. Then let's go down here. Now we have down here, we have serotonin, right? So serotonin is, what does that do in your body? Serotonin is what relaxes you. That puts you in the parasympathetic nervous system. So we have the sympathetic nervous system, which is run away. Then we have the parasympathetic nervous system, which is just like relax and digest. Right now, if you see this here, the serotonin level is on the low side right here. So what do we have? We have the excitatory hormones, which are increased. Then we have the calm and digest and relax hormones, which are on the decrease. Now, guess what? This can be related to mold and candida and yeast in the gut. This will throw off your neurotransmitters. This is why this test is so valuable. This is why if you're sitting here, right, you see this video, give me a thumbs up, right, subscribe to my station because we need to get this content out here. I'm connecting the dots. I'm just acting as a guide. There's too many people suffering that don't know this information, man, that have never had a workup like this. Now, here we have, this is also number 56. This is NAC or NAC. Now, you see this range here. I like to see NAC or NAC way down here. Now, you can see he's way up on the upper end. Now, what does this tell you? NAC gets converted into, guess what? Glutathione, okay? So NAC gets converted into glutathione. So if you have high amounts of NAC, guess what this is telling you? That the NAC is not getting converted into glutathione. And glutathione is your number one antioxidant in your body. So if you're not producing enough glutathione, then you're going to have problems with oxidative stress. You're going to have problems with inflammation. All these things start to happen. So this is why this test is so critical, is getting this organic acid test and the mold test. Now we're going to move on to blood. Now he also has blood sugar dysregulation. You can see this is an A1C. This is a 90-day blood sugar marker. Now down in here, what does it say? 5.7 to 6.4 is considered pre-diabetic. Now I find lots and lots of people that don't have optimal blood sugar, right? So they're pre-diabetic. If you're pre-diabetic, too much blood sugar, too much insulin, too much sugar floats around in your bloodstream and causes you to be in a state of chronic inflammation, right? So he talked about neuropathy, he talked about vision loss, right? He talked about all these different things that are happening because he's in a state of inflammation. So this is why connecting the dots is really critical. Then we took his vitamin D, and what do we see here? Is we see it's 35 right here. Now you see the range is 30 to 100. So in the conventional system, they're going to tell you your vitamin D is what? If it's 35, it's normal. It falls within the range. Now, we're not talking what normal is. We want to know where healthy human beings live. We want to know where your sweet spot is, where your spot is so you can get better. And it's not at 35. The sweet spot is around 80 if you have chronic conditions. So this is why all these different intricacies, right, a polytherapy approach, the tests are just a fishing net. We do the test, we reel in your fishing net, we see what we have, we see what the labs say, right, see what we caught, and then from there we come up with a customized, individual, tailored plan to fit your needs that guide you. And it's very simple. I laid out a plan. Let's do step 1, let's do step 2, let's do step 3. Watch these videos. It's very, very simple. I'm acting as your guide to get you better. We're taking out of the confusion on your recovery, which is what people need. All right, so this right here is 35. Now let's go on here. We did homocysteine. Homocysteine should be between 6 and 7. This is an inflammatory marker. They've done lots of research on if you have high homocysteine levels, you're more prone to neurological degenerative conditions, such as Parkinson's disease, such as Alzheimer's disease, such as mild cognitive impairment. So homocysteine is a pro-inflammatory marker. It causes your brain to be inflamed. It also has to do with DNA replication. So if you have a high homocysteine level, that tells you that your DNA isn't being replicated very clearly. So if you take a copy of a copy of a copy, and on 1,000th copy of your DNA, right, it's not going to be very crisp and clear. This is what happens when you have a high homocysteine level, is that DNA that's replicated on the 1,000th copy isn't very crisp and clear. Therefore, it can't tell the cell to function well and do its job, and therefore you're going to get problems. So this could be a genetic problem. This can be because you have poor B12 status absorption. Why would you have poor B12 status absorption? Maybe you have leaky gut. Maybe you don't have enough hydrochloric acid in your stomach. Maybe you're low on digestive enzymes. Maybe you're low on gallbladder acids, bile acids. All these things need to be taken and looked at. Maybe you're sensitive to gluten and you're eating gluten, and that causes your gut to be chronically inflamed, and then you cannot absorb vitamin B12. Now, if you can't absorb vitamin B12, there's a high probability that you're not absorbing other nutrients as well. So we're still on the blood test. Here's insulin. This should be between 5 and 6 here. We are at 16. So this is an insulin marker. Insulin is a hormone. It's a pro-inflammatory hormone. Imagine this. It's like glass shards in your bloodstream going around on your organs and scraping your organs. So we have high insulin, which just envision this happening in your bloodstream. Little small glass shards of glass going around and slicing all your organs. So we have high insulin. And on top of that, we have high oxalates. Now, oxalates aren't really in your bloodstream. They get deposited in your tissues. Right, so your muscle tissue, your brain tissue, neurological tissue. That's why when you move, it's very, very sore. It can be very, very tender. And then magnesium right here is 5.4. It falls within the range there, but we want to see this 6 or greater. So he's not in the sweet spot for magnesium. So anyway, I hope this has brought some value to your life, to your case. If you're out there, you see this, you're like, man, I can get some help. Down below, there's an opportunity for you to get better. You can get well. You just need to take a polytherapy approach that's custom designed for your specific needs for you to get better. So that being said, just remember, is where there is help, there is hope. Take care. Bye-bye.